Now there's a new STI you've probably never heard of. It's called Mycoplasma genitalium. It's on the rise. Oftentimes it's misdiagnosed as another STI such as chlamydia. So the question is, how worried do we need to be about this new STI? Did you study?
It was so simple.
Really, in terms of STIs, there was just so few to worry about.
In terms of STIs, the 60s and 70s, pretty simple. You were worried about something that was readily treated with penicillin. Is that suffice it to say?
Enough. Yeah.
Right? And so you weren't worried about all these other things. Now you've got a whole litany of STDs that you have to be concerned about. And you know why we're talking about it is because they're all a little bit different. You treat them differently, although they may present in a similar way.
Exactly. And so I think with this one, it's actually been around since the 1980s, but we're finding that it's steadily increased. And it's transmitted by genital to genital contact. Same types of symptoms in terms of penile discharge, maybe pain. For women, it may be bleeding or pain with intercourse. So in this case, the reason it's relevant is because it's often misdiagnosed, as you said, as chlamydia. And the antibiotics that work for chlamydia actually don't help this particular organism and can maybe even contribute to resistant strains. So for mycoplasma, the treatment of choice is something called azithromycin, and we often are given that for upper respiratory infections, bacterial infections of your throat and your nose, but it's not the typical penicillin that you mentioned because this won't even respond to that. So that's what makes it interesting.
Well, I think the other thing interesting about this is that if you are going in with these symptoms and you get tested for it, they're going to typically test for chlamydia and gonorrhea, but they're not even traditionally going to test for this. So you could have a clean STI test performed and be stricken with Mycoplasma genitalium. They call it MG, and you
MG
theoretically
is NG.
You know, and if you're not on the lookout for this, you might say, well, this doesn't look to be an STI, so let's just watch and see, because you have to get a special study done.
In the ER, if they come in with these symptoms, you assume that it's an STD. Well, the good news is that azithromycin
can be used to treat. Potentially can be used to treat chlamydia.
So that's what you would do until you got a culture back?
Yes, if I were concerned, because what it comes down to, and one of my biggest concerns with these sexually transmitted infections is that they're also getting a little more clever. So as we throw the traditional antibiotics at them, so to speak, they are learning ways to become antibiotic resistant. And I think we're seeing that with a lot of these bacteria, and this is a unique bacteria. And so I do worry because I don't know about you all, but this was not one that we were studying in med school back in the day. Yeah. So that's when I say on the doctors, you never know how things are going to evolve, because I didn't learn this at all.
Well, I think it goes back to the point that condoms, because across the board, that is going to be your best line of defense. Anything, thank you for a high five for condoms.
We talk about a lot on the show about the health benefits of sex with your loved one, but we have to emphasize that unprotected sex with a partner that you do not know if they have a sexually transmitted infection puts your health at risk. Because the issue with these types of infections is, take women as an example, you can develop fertility problems. And so there are issues that go beyond just the initial symptoms and treatment. So here's what I would say is, if you have these symptoms and you get tested and you continue to have these symptoms, this is one to potentially bring up with your provider, because again, this is not something that a lot of providers learned about in medical school.
And I think the numbers are staggering on this in terms of STIs in general. This is an area which is actually on the increase. So of people who are sexually active by the age of 25, 1 in 2 will develop some form of sexually transmitted infections. So that's a staggering number.
And I think there's a reason why it's on the increase in that it's not being diagnosed properly and maybe not being treated properly. So it stands to reason. And you know, condoms, as you said. But you know, if you're getting into a relationship and you want to make sure that you're not bringing anything into the relationship, you know, there's a whole battery of things that you need to be tested for, and mycoplasma is one of them.
One thing I would add is, let's just use the example of if you're what we call the urethra, where urine comes out, if you're noticing just some bizarre itching down there and you've been engaging in unprotected sex, You may not have big time overt symptoms, but if you notice something's wrong, get it checked out, because the reason it's so important is not only to treat yourself, but if you're having unprotected sex and you're having these symptoms, then you are potentially passing it to your partner or partners if you have multiple partners. And this is just something to be aware of.